Hey guys, this is Dr. Hub. Today we'll look at the sensory innervation. So the sensory innervations, and the sensory innervations is going to be of the tongue. So let's look at the anterior two-third. So anteriorly two-third, what is the general sensory? So first we look at the GS, which stands for the general sensory. This is going to be the lingual nerve. So this is nothing but the lingual nerve. So the lingual nerve this is nothing but the CN5. And what is the special sensory? The special sensory SS is going to be the chorda tympani. Chorda tympani, this is nothing but the CN7. Next we look at the posterior one-third. The posterior one-third, the general sensory, if you see, it is going to be the glossopharyngeal nerve. The glossopharyngeal nerve is nothing but the CN9. So what is the spinal special sensory? SS, we are writing it as special sensory. It is going to be the glossopharyngeal. So the anterior two-third of the nerve, it is controlled by the lingual nerve, that is the general sensory, and the special sensory is the chorda tympani. Posteriorly, it will be the glossopharyngeal, that's the CN9, and SS is for the special sensory, it is a glossopharyngeal, again the glossopharyngeal nerve. This is nothing but the CN9. Then we move on to the area that is posterior most tongue. The posterior most tongue. So this posterior most tongue, what are the structures? It is area, it will include the valleculae as well as the epiglottis. So valleculae and the epiglottis. So what is the GS? That is the general sensory. The GS is the general sensory, it will include the internal laryngeal nerve. So ILN, the internal laryngeal nerve, that is nothing but the cranial nerve 10. Next we look at SS. SS is nothing but the special sensory, and this will again include the ILN, that is a cranial nerve 10. So there is another diagram which is easier to understand. So imagine this is the tongue. We are dividing into three sections. That is the posterior most, there is a posterior part as well as the anterior part. So anteriorly we have the sensory is from the lingual nerve, and the taste is from the chorda tympani. Chorda tympani, that is the 7th. Next we look at the posterior. Posterior we have the sensory and the taste, and here it is nothing but the glossopharyngeal nerve. Glossopharyngeal nerve, that is the CN9. So posterior, what we mean is the posterior one-third, and anterior, what we mean is anterior two-third. So what happens in the posterior most part? Posterior most part, there is a internal laryngeal nerve, that is a vagus nerve, the CN10.